Hi, my name is Julieta and my team is conformed by Ana, Fernando, Elena and me. We are going to talk about nursing care plans in leukemia patients. This is the TBL project for the English class taught by teacher Azucena.
Hello. So, as first of all, I would like to say what leukemia is. Leukemia is a malignant proliferation of white blood cells precursors in bone marrow or lymph tissues and their accumulations in peripheral blood. Basically, is cancer into the circular system that attacks into the blood cellular components. Why do we decided this topic? We decided this topic because we, as healthy students, especially into nursing, want to help to the patient into this process because when the patient is diagnosed by leukemia, he has to or she has to um, go into the chemotherapies. So um, we want to help him because he's going to have a lot of symptoms and signs, and after the chemotherapy he or she maybe needs some help. So some of the signs or symptoms that I'm talking about, that after the chemo maybe the patient feels so tired, so weakness, maybe he has fever, maybe he has pain into the joint or bones. And yeah, we as nursing want to help him into this caring, um, into the caring of the patient to make him feel more comfortable. So yeah, the first nursing intervention is to place the patient into a private room. He has a limit of visitors as they are indicated by the doctor. He has prohibited leaf plants or flowers, restrict fresh fruits, and make sure they are properly washed or peeled. Um, Coordinate patient care so that leukemic patient doesn't come in contact with staffs who has also care of patients with infections or infectious diseases. This disease is not contagious, and we want only to help to the patient to make him feel so more comfortable and into taking care of him, that he doesn't get hurt by something or into the room or the hospital, so he can be into a safely place. And yeah, that's our proposal into the 5 nursing interventions.
We just help personnel want to help the patient in this painful process by helping them to feel better. And whether it is applying medication for their discomfort or helping them with activities they have to do, and accompanying them during their chemotherapy. And it's important that they don't feel alone during this process. The care plans for the leukemia patients enforce the comfort and avoid the effect adverse of the chemotherapy treatment, and promote psychological psychological treatment for this process with where.
Hi! In treatment, each patient needs some care, such as these 5 nursing care plans for a patient with leukemia that I am going to mention. 1. Risk of infection. 2. Risk of deficit liquid volume. 3. Share pain. 4. Attitude intolerance. 5. Poor knowledge. As nursing staff, we must support and make the patient more comfortable. Mm, there are also interventions in each plan of care. Some common treatments to fight it is a chemotherapy, which is an important and main for leukemia. Radiation therapy, bone marrow transplant, immunotherapy, and immune cell engineering to fight.
Hi, the second nursing intervention is monitor I and O. This is calculate insensitive losses and fluid balance. We are going to notice diminished urine production in the presence of adequate intake because tumor lysis syndrome occurs when the destroyed cancer cells release toxic levels of potassium, phosphorus, and uric acid. Since elevated levels of phosphorus and uric acid can cause the formation of crystals in the kidney tubules, which impairs filtration and leads to renal insufficiency. The third intervention is investigate reports of pain. We will notice changes in grade and size. And here we are going to use a scale from 0 to 10. It is useful to assess the need for intervention. The fourth intervention is to assess reports of fatigue, taking into account the inability to participate in activities or ADL, because the effects of leukemia, anemia, and chemotherapy can be cumulative.